Great, and good afternoon, everyone. Thank you for joining us here at the Region 9 Head Start Association for this session. As with so many other organizations, we're eager to support the Head Start community as we move through this crisis together. Each day, and even throughout the days, information has shifted and emerged related both to COVID-19 as well as Head Start and the early Head Start community's response. This week, we know that the Office of Head Start has issued several items via email. Each are posted on the ECLKC website. And we certainly appreciate the Office of Head Start's expressed trust in local programs and their supportive posture toward grantees as we navigate this together. Also, you may wish to note that the National Head Start Association is working on several fronts, and we're appreciative of that as well. From hosting the weekly kitchen table talk on Wednesdays for programs to share ideas and ask questions, to the government affairs staff that are working hard to tie down the answers to critical questions related to both regulations and funding. We're appreciative of the hard work that so many are doing, both within this community and allies to the Head Start community, to serve not just the families and children, but as well as the staff who work so tirelessly each and every day. Today, we are pleased to have three presenters to bring forward to share information from their program's view and expertise. In just a moment, I'll be welcoming Pamm Shaw, Nina Paddock, and Charlotte Hendricks. Each presenter will share about 15 minutes, and then we will open it to questions. I expect that many questions will not be completely answered, but we will log the question and share them with appropriate experts. You'll hear in just a bit how we will be continuing to dialogue with the field through gathering of resources on our own website, in addition to those shared on this call. So at this time, I would like to welcome Ms. Pamm Shaw. Pamm is the Vice President of the YMCA of the East Bay, and they are both a Head Start and Early Head Start grantee. Pamm has an extensive background in early education, disability services, professional development, and leadership within our community. Good afternoon, Pamm.
So just to, by way of introduction, I live in the Bay Area. I am over 65 and under house arrest. And well, what is it, shelter in place? Because I'm in one of the seven now Bay Area counties. And I'm coming from a perspective of having been a longtime Head Start director, as well as a child care director, because we have both state and federal funding. I've been on the phone and Zoom and computer nonstop the last 2 days, well, longer than that, but particularly the last 2 days, as many of you have. And some of the things I'm going to say are going to be things that you've already heard if you had the opportunity to sit on some of these webinars, webcasts, conference calls. Many people in California listened to the Department of Ed webcast this morning. Community care licensing was yesterday. The Office of Head Start was yesterday. And in our county, we have, well, we serve 4 counties, but in one of our counties, we have a state contractors group, and we've been meeting through Zoom every couple of days to just check in with each other and find out what everybody's doing. And that includes the 6 Head Start programs in the Bay Area. We're all part of that group, or of the East Bay. So that's in an introduction. Are you going to ask me questions, Ed, or should I just keep talking?
No, thank you, Pamm. Thank you for that introduction, and I want to just kind of get right to the meat of it. I think programs, as we've observed, are in very different places. We have heard from some that have closed centers, and some are just reducing internal meetings to 10. Our Office of Head Start says, we trust you, but what do you believe are the critical elements in the decision to close centers, given the information you've heard this week?
So I'm going to reiterate what, the Office of Head Start director said, use common sense. That's the most important thing you can do at this time. We're looking at our local school districts, at public health departments and state health departments. If the public health department locally is saying just stay open and operate as usual, because all of the recommendations coming out of the Centers for Disease Control and other sources are saying to do things that would make it almost impossible for us to stay open and not put our staff at risk. So we're looking at all those things. Is how do we take care of our staff? How do we take care of each other? How do we take care of our children and families? How do we maintain communication? What do we do? And how do we do it? And the best way to do it is to sort of step back a bit and have a plan, create a plan so that you know what you're doing and you're confident in doing it. And again, I'm going to say common sense rules.
And as that plan is shaped, who are you communicating out to? Well, who's on the top of your list as a program leader that you feel are most critical to have the information as to the decisions that you're making short and long term?
So right now in our agency, we have a team. We have multiple levels of teams. So the highest level of team, there's only 4 of us making like some of the big decisions that are shaking down. That includes me, it includes the new executive director, it includes the fiscal person and the health person. It could be anybody you choose, but it can't be a huge team that's going to be making decisions really quickly. The second level of the team are all the managers, and then the third level is all the managers and supervisors. And we're trying to do Zoom meetings or some variation on Zoom, either daily or every other day. In addition to that, we're in touch with our grantee staff to see what's happening with the larger agency. We're part of a YMCA. We have been shut down locally. So that is of huge concern to my boss who, because we have health clubs and those are the pieces of the Y that generate the resources for the rest of the agency, including for our early childhood programs. So it's very much of a concern right now to maintain sanity and just keep in regular communication. And regular means daily or even hourly if that's what it takes.
So for leadership, maintaining trust is essential. Given what you know about the situation today, how would you suggest to program leaders that they sustain their employees' trust in the short term and in long term?
You know, I was laughing when I was looking at the question, because if you have a good trusting relationship already, it's going to continue based on how much you communicate with people. So, you know, I've kind of got like my little 4 C's here. It's care, communicate, collaborate, and check in. So show people that you care about them. They want to hear from you. They want to know that you care what's happening with them now. They want to know that they're home with their kids and trying to figure things out themselves for their own families. And then how are they supposed to worry about other people's children at the same time? Again, that ties in with the communication on a regular basis and just reaching out to people. Collaborating with others. One of the best phone calls I was on today was to find out what all the other programs in our county are doing and how they're communicating with families and what kind of activities they're doing. So we're setting up a resource exchange for all the families in English and in Spanish and trying to share those resources amongst ourselves so that nobody is recreating the wheel. And if somebody is doing something good, interesting, easy to implement, then somebody else can do it as well. And then the last one is check-in. What supports do our staff need in order to work at home, in order to be functional, in order to serve their own families? It's a blessing. Our staff are getting paid. The Office of Head Start has indicated they're going to continue to pay us. The Department of Education has indicated that they're going to pay us. So this is the plan right now, is that staff are on board, they're working, and we're just creating a plan for what that looks like in terms of how they do the work and how they document it. And we're rolling it out pretty slowly. Some other agencies have moved a lot faster. You know, we're just not at that place. And I think any speed with which you go is okay, as long as it's thoughtful and not confusing people.
And Pam, you say you're in contact with other agencies. What would you say are the top 2 ideas you've heard today that seem to really strike at the place that programs are at in this crisis?
So a couple of the things that I heard that were really exciting, we're doing Zoom meetings with small groups of children and families, reading stories online, singing songs. We sent out a link, or we're sending out a link this week. We have a soda tax money, so it's all music and movement in English and Spanish about drinking water and being healthy. And that's going to go out to every family through text today. I think it's about to go out. And that's exciting. So it's something for the parents to do. It's easy. The kids all know the songs already, so they've been singing them at home already. So it's something familiar that they can do, that they can remember, about being in school. Another one I heard for people using Learning Genie for the family engagement part of it is to send information to parents via Learning Genie. You could send books and stories and things like that. The other one that I liked also was doing special ed services, early intervention services through Zoom or either individual or small group meetings. There was some discussion about confidentiality when you do group work. And I think if you get parent permission beforehand to do it as a group, then it's okay. If not, then maybe that parent is done one-on-one versus in a small group. But those are a couple of the things that we like. Another agency is preparing bags for parents to come pick up with diapers and baby food and resources and activities for kids, crayons and marking pens and paper to take home for those families who don't have those things.
And so one of our questioners has asked, as you move through your plan to close your centers and reduce your services, what's the reopen plan look like? Have you gotten to that yet, or is that too far down the road of considerations?
So we are, like I said, we're a county that's shelter in place through April 7th, through midnight April 7th. So the first day we can possibly open, unless they change that, would be April 8th. If they extend it, which is a strong likelihood, we will follow what the local counties are doing in the local school districts at this point in time. And as we move through this over the next week or two, we're kind of going week by week in terms of how we're planning. Like, we're covered for this week. We know what we're going to be doing next week. We're starting to do that. We're having regular meetings to talk about what happens next and how it rolls out. And then as it gets closer and closer to opening, the centers are all being cleaned and sanitized as we're speaking now. So that's one thing that is happening while we're gone. We're monitoring supply deliveries and things like that, so nothing is delivered that would get ruined. We heard the other day that there was a stack of Amazon stuff on the front steps, so thank God nothing was stolen that we're aware of, and then a staff person went by to check it out and brought everything inside. So things like that to just keep tabs on.
So Pamm, Head Start families and staff are anxious, and given the times when they may also be very limited in their attention span, so much is coming at them. What do you think are the most important pieces of information they need to be aware of as we move into more and more physical isolation from each other in the next couple weeks?
So, thank goodness we are in a time of FaceTime and Zoom and the ability to communicate with each other. I'm 99% sure that 100% of our families have cell phones. They may not have any other kind of communication, but they all have cell phones. And it's my understanding that nobody's going to be cut off from not paying bills or anything right now, that people will be able to maintain that level of communication. But keep yourself and your family safe and healthy. That is the most important thing right now, to let people know that. Follow the guidelines, follow the rules. If somebody in your family is sick, take care of them especially and report it up the ladder so that they get the support that they need before they get too sick or they need hospitalization. One of the things we're trying to do is keep people as healthy and safe as we can from the beginning instead of waiting, which if it says stay home, we're seriously saying stay home. Do not go out and about. This is really serious. And then stay in touch. Again, we're trying to set up networks of people and systems, and particularly the teachers and family advocates who are on the line closest with the families, to be available to them at least certain times during the day, and schedule regular meetings with the families at least once or twice a week to check in with them and make sure that they know what's going on. And that at least if they're isolated with just kids, that they know somebody is out there that's thinking about them.
Good advice. On the call with NHSA today, another program, I believe, from Kansas had made the comment that their families switch phones quite often. That's been their experience. And so they're moving to the top of their check-ins, confirming the phone number that's the best to reach them by, so that they have multiple phone numbers, or at least are aware of when a parent may be changing phones, so that they don't get caught off guard. And the second piece of advice was, when making appointments, keep the appointments. Do your very best to standardize and be there when you say you will be, because of the tension of just the anxiety of not having those regular connections. So both
absolutely.
good
And then
pieces.
the other thing that we decided to do today is, any family that does not have an email address, we'll work with them to get an email, just, to get a Gmail account or something. And to make sure that they're hooked up to free internet, because Comcast and some other providers are giving out free internet right now, at least for the next 2 months.
So the Office of Head Start shared that programs should do all they can to support staff and contractors to minimize the economic impact in local communities. What activities do you suggest that program leaders consider undertaking to make sure that they monitor spending during this period?
We're really looking closely at that and seeing what it means. I mean, if we're not serving children in the center, we're saving some money. And can we use those dollars? Not only, we're paying for staff for sure, and we're paying our contractors, or at least most of the childcare contractors for sure. But to keep things so that when we're ready to open, we're ready to open, which means that the food is there the day before we open, and that all the supplies we need are there, and that we're not giving away things that we need to be able to operate the program in 2 weeks from now, and that we have the ability to get it, because deliveries right now are way down and much slower than they might have been in the past. And the second part of the question, can you repeat it?
And I'm just checking our time, so I'm going to go ahead and move us forward and just wrap up this part of our section to ask one last question, and that is both on the National Head Start and at the Office of Head Start, they urged us to collect stories of challenges or stories of success in terms of how our program is responding, and to push those stories up the food chain. I'm curious, are you actively monitoring for some of those stories, and how do you suggest other directors do some of that as well, to make sure that we capture both the stories and the lessons that we're learning as we move forward?
So I got a great text today from my former PC chairperson who works in subsidized housing, that she just placed one of our families that was in a shelter today. And so it's like, whoa, huge success, because this family's been looking for housing for a long time, and she was able to link with this family and get them housing today. And this is right now, one of the things is, we want these people out of shelters as much as we can, or the people that are on the streets, to get them into housing as quickly as possible. So I see that as just a huge success. Not necessarily for what the program did, but our ability to link parents with other parents who have resources. And so for me, that's part of what Head Start is able to offer, not just what staff can do, but what parents working with parents can do as well. So I agree. I think we should start collecting these stories. This is just the beginning. I mean, every year there's something that's happening. And if they say what's going to happen with this is the first cycle, and we should be collecting the data and information to be prepared, so that next year we're not taken off guard like we were this time to some extent, and thinking about how serious this is. Even if it's just a regular flu, we need to pay attention to what's going on and what really works during this time, and maintain, calmness and sanity throughout. So.
Thanks, Pam. Thanks for sharing your wisdom, your experience, and we hope to call you back to the table, if you will, as we move forward and continue to monitor the experiences and lessons that you're picking up in your role there at the YMCA. I do see 3 questions here. I'm going to hold off on answering them. Some are more particular to certain aspects of the organization. For our time today, I'd like to go ahead and move forward, and that is to invite Nina Paddock, who is the Comprehensive Services Manager at Pacific Clinics Head Start, Early Head Start. Nina has over 23 years of experience working with Head Start and child development programs, serving at-risk infants, toddlers, preschoolers, and their families. She is currently the Comprehensive Service Manager for Pacific Clinics. Nina has presented with our conferences a number of times over issues of social and emotional considerations for this community. Welcome, Nina.
Thank you, Ed. All right, I have a lot of information. This experience has definitely tapped into our emotions, our social interactions. So I have put a lot of information into 12 slides to cover in 15 minutes. We'll try and move through quickly, but I'm just going to cover some of this through that lens of trauma-informed care, managing our own stress, in how to best communicate appropriately with each other and our children, how to make sure we're staying connected with our community and the supports within our community, asking for help, and then just being aware of what our emotions will go through and the effects they will have. And then I have put together a variety of resources for you to look at. So first of all, we all know this has been stressful times. And one good thing to keep in mind is that stress is good, as long as it is tolerable stress. So positive stress, like giving a webinar presentation, that's your brief moments there. That's the positive stress that you see at the first level there. The next level would be a tolerable stress. This is a little bit more serious. It lasts a little bit longer than just your brief right before an incident and then recovering from that incident. Tolerable stress is going to be something that lasts longer. And what's going to make it tolerable for us or help us move through this is to have good buffering relationships. And that is true of both our relationships with each other as well as children's relationships with adults and their caregivers. Knowing, of course, that we do not want to get to prolonged periods of toxic stress that can have serious effects on children's brain development, disruptions to their physical development as well. So although this is a stressful environment that we are in right now, there's a lot of people who are extremely stressed. Let's try and remember that tolerable stress can be a time to really work on our relationships, and that it can help us and our children through part of this healthy development, knowing that things occur and we have to move through it. I did put in the link into this slide. There is a whole bunch of information on this website, the Developing Child at harvard.edu, on all kinds of stress, so you can check into that. I love this quote here from Toni Morrison, and this is one that I think really talks to caregivers of young children. We need to remember that when a child is with us, whether it's in a room physically or even through a video screen, your child or anybody else's child's eyes need to light up. We need to make that connection. They can see what's going on inside us. Even though we might say, it's fine, it's fine. Children see, they see into our eyes. And just like we need to look into their eyes and see how they are doing too. All right, so we have this stressful situation we are in. We need to make sure that we as caregivers, that means Head Start staff and parents, are managing our stress appropriately. And some of the things that get us in the most trouble during our stress are those thoughts that come through our head. They aren't even verbalized outside. It's our self-talk. It's those things where we say that it should have been this way. I could have done this. I'm not doing good at that. That self-talk, those should statements, that all or nothing, or that predicting that things are going to be a catastrophe or not work out, that we say in our head, is a lot of what causes our internal stress levels to increase. So be aware of your self-talk. Give yourself that positive self-talk. Know too that our stress impacts those around us. Parents and caregivers, teachers, staff, supervisors, we need to make sure we're managing and reducing our own stress so that we are fully able to build good nurturing relationships and support those around us. So we need to keep calm, and we need to make sure we're using strategies to decrease our own stress. Higher stress is going to affect the way we think. If we're stressed out, you can't think clearly. I don't know what to do. What am I supposed to do? This is crazy. Those thinking, we need to be strategic. We need to be thinking clearly. Take deep breaths. Make sure you're making your thoughts clear. And then be aware of your emotions. And I'll talk about that a little bit more coming up. So here's some strategies that we can all be sharing with our staff, all those caregivers out there on how to manage our stress. First of all, as was said in the previous presentation, we need to be showing that we care, and that's care for ourselves as well as those who are taking care of the kids and all those around. We need to be giving pats on backs. We need to be remembering and thanking individuals for all these extra efforts, all these extra steps they're taking in. And that includes ourselves. So personal strength, giving yourself a pat on the back. Okay, I did a great job with that. I got my kid to do those activities. I spent 15 minutes with my kid. I got my staff on a video conference call. Yay, give yourselves pat on backs for those little things that you are achieving and making happen. It makes a big difference. We need to make sure that we are being mindful and identifying positives that are happening. I shared with my staff today, we were all sharing something positive that's happened in the last day during this crisis. My son had a St. Patrick's Day hat. He was all set to wear to school for St. Patrick's Day. He doesn't get to wear it. But his teacher video conferenced with him, and she had her St. Patrick's Day hat on, and he was so excited. And then he was telling me how he got to meet her dog because she was video conferencing from home. And that would never have happened otherwise. Take those moments, find those good, beautiful things that are happening. Be mindful of all the amazing things that are happening around us, people coming together, people helping each other out. Those will help us get through. And then this is a time to maintain good routines. Create meals together, sit down and enjoy food together. Time has slowed down a little bit. We have more time at home together. We do need to keep kids with routines. This is not the time to let your children sleep till noon or let the kids sleep till noon or stay up till midnight watching videos or eating a ton of candy. We know that children and us as adults are going to feel safer and do better if we have a set structure and routine. Get up, go out, take a walk, be active. Make sure you have those good, healthy routines in place. And get good rest. Sleep is important. Even during this time where you're not out and about, sleep is important. And then make sure that you are doing some relaxation techniques, and I gave you some suggestions there. I put this slide in just to show you, people are gonna have meltdowns. It's stressful, stuck at home, stuck where we are. Create in your home, wherever, for your kids, for yourself, for the caregivers, a calm down spot. This is my spot I go when I need a moment to calm down. This tool works great for the kids. It works great for us as well. I need a calm down spot. Laundry room, wherever it is, you got a lot of kids at your house or whatever. Be informed and inform your families. This is super important as we think about how we communicate, which is another part of trauma-informed care. So make sure that everything that you are telling children about the coronavirus is accurate. We don't have to tell young children everything about the coronavirus, just like we don't tell them everything about family problems or other adult issues. But what we do tell them has to be true. Telling them something false is not helpful. Make sure that everything we tell young children about coronavirus is described in an age-appropriate way. Young children aren't going to understand big in-depth information about transmission rates or how different illnesses are spread or actions the government are taking, such as flattening the curve. But short, simple explanations are good. I put links down here to 2 different little videos that help explain it if parents or adults don't know how to explain it. One is from pbs.org, that's a younger one, and then the other one's from NPR, a little bit maybe middle-aged kids, middle school or older elementary school kids. Great little guides. You can watch first and then watch with your kids and discuss. In the blue little thing there on your screen too is a brief explanation of how you might explain it to kids in a simple way. We want to provide just enough information about coronavirus that we are answering their questions and satisfying their curiosity, but not too much that we are making them anxious or afraid. If your child asks if someone is dying from this illness, you should do your best to answer that question in an age-appropriate way. But if young children don't bring up things like dying, then don't bring it up. Children will have fears and concerns around this because they see and hear what's going on around them. But they may not have the confidence to bring it up to us. So sometimes starting the conversation with the simple open-ended question, what have you heard about this? What are you worried about? Are a great way to get that conversation going. And then a final reminder is limit young children's exposure to the news and all the information that's out there that's more aimed at adults and not young children. So as we're communicating with our children, as we're spending time with children, both either through the video conferencing or in person with our own kids, sharing with parents the importance of that serve and return relationship. That this kind of back and forth relationship and play is what helps build brain structure. And that this builds a good foundation for those children to build their responsibility and their understanding. If we as adults are providing unreliable, inappropriate, or simply absent information to young children, we are going to throw them into stressful situations. So if we tell them lies or we tell them false truths, or if we say, don't worry about it, or it's not important, you know, something like that, that is inappropriate or unreliable information. And they know something's going on. Please make sure that you are responding to their questions and asking them. So there are some steps to follow as far as that serve and return. And this is both verbal back and forth as well as when you're playing with your children. So paying attention to what they're focusing on. What is it that's caught their interest? What are their questions about? Offer children comfort with a hug, gentle words, help them, play with them, help them understand the world around them and know what to expect. This gives them words to use and lets them know that you care. And then give them a chance to respond back once you've given them some information to see if they have fully understood it. All right, so then remember that as we are in this situation of social distancing, that does not mean social isolation. So as Pam explained, we need to be connecting with each other. It's so important. So keep connected with family, friends, through social messaging, through phone calls, through video conferences. Get outside to whatever is available, taking a walk, getting some fresh air, playing outside. Social isolation does not mean don't step outside your door, okay? Fresh air is good. Virtual field trips, take them places virtually that they used to like to go or they might be interested in. And then make care packages that connect them with the outer world. So letters, arts, family, friends, how great that they could start getting mail again, right? Part of our trauma-informed care too is being kind to each other. So think of building those kindness skills through our activities with kids and with others. So planting a seed and watching it grow. The sun still comes out every day. Let's celebrate that. Making gifts for neighbors, donating clothes or supplies. Lots of people are gonna have needs. How can you help out? Helping clean the house. That's something we can do to prevent spread of germs. And then this is so important, as Pam mentioned too, is to be grateful and say thank you. That makes so much of a difference for individuals. So our emotions are going to get out of whack. We are going to have emotional breakdowns. We're going to be challenged. Here's a chart. I love this chart because I use it when I am feeling that emotion of fear. What that means is that I am focusing right now on a threat. And my motivation for focusing on that threat is that I am trying to protect something. So if I think back around, like, why am I so fearful right now? Oh, I'm trying to protect what I'm doing. That makes it so much easier for me to say, I can protect those things in a better way. I don't have to be fearful. So using this basic emotion chart to kind of help identify our emotions, but we need to also help our children identify what emotions they're going through. So how to express their own feelings. There's some ideas there on how to help build children's knowledge around feelings, emotions, and identifying them. Taking your children's temperature, emotional temperature, just ask them, how are you doing today? How are you feeling today? What is your emotion you're feeling? And then I put in a whole bunch of resources. There's so much great information coming out, wonderful links to different materials, curriculums. As Pam said, we got to share all this stuff and keep each other informed of what's working so that hopefully we all get there. And then all of us need to remember for the young children in our life that connection is important and that we might not be able to reach all of us at one time, but each of us is important to at least somebody.
Thank you, Fernando and Ed. And it's been a real challenge. Nina, you talked about stress. Well, trying to figure out the computer technology for this webinar was stressful for me. And I think I beat you because I have more slides than you do in the same amount of time. But I chose to go with a picture says 1,000 words. So what we're going to look at is a lot of different examples of information. Next slide, please. Oh, I wonder if I can, no, I can't. Can I do that? Nope, you can do that. I'm still figuring out the technology. Okay, next slide. There's a lot of information that's available, and it really doesn't matter if you are in California, Washington, New York, the areas where there's high COVID-19, or if you're in a more rural area, it's still the same information coming out and the same panic and false things, information's coming out. So what I would like to talk about is how do we work with parents and do just as Nina said, you're talking with children and giving them accurate information. We want our parents and families to have the same accurate information. One of the first things I've noticed in information that comes out of the media or Facebook, social media, print, is that it's sometimes hard to understand what they're saying. So just a few terms I came up with. Okay, there's coronavirus and there's COVID-19. It's the same thing, different name. They call it a novel virus. It means it's new. What's an epidemic? That means there's more cases than is typically expected in a community. So you could have an epidemic of the flu, or even 1 or 2 cases of measles is considered an epidemic. Pandemic means that it covers multiple countries, or it could be a pandemic meaning multiple states. In this case, it's worldwide. Another term there is asymptomatic. Most of our parents don't know what that means. It means you have the germ, you're carrying the germ, you can transmit it, but you don't have any symptoms. So when you look at information or you're giving information to your families, be sure that you explain the symptoms, or I'm sorry, explain the terms. Next slide. Next slide. Oh, and Fernanda, I'll tell you, I'm going through the slides very quickly, at the most 20 seconds per slide probably. Let's look at where people are getting their information. They get it from the news, the media, but as you mentioned earlier, most of our parents, if not all, have cell phones. Then a lot of times their information comes through the social media, especially Facebook. There can be websites, they get it from their friends and families. It's Head Start and the schools, and then healthcare professionals. Next. What I decided to do was just show you some different ways to get information, the ones that work, the ones that don't work. If you're going to websites, the best website is cdc.gov. Now, some people will say, oh, it's a government agency, they're just feeding you what you want. No, CDC is a great agency. I've worked with them for decades, and they are up to date. They're giving you the best and most accurate information, and they're not going to give you false rumors. So if you just go to CDC, I put 3 little snapshots here. The first one shows you the homepage, and it has coronavirus disease right there where you can click on it. Then if you click that, you go to the next part, and again, you can see symptoms, prepare your family. If you go to the next one, it's got schools and childcare. So it's easy to navigate. That's one thing to look at. Next. Also with cdc.gov, they have always given information on things you can do in schools. So there's just another slide that shows what they have. Next. If you go to your state and local health departments, if you go to California Department of Public Health and you go to their homepage, immediately you see COVID-19 on the homepage. You can click on it and get information. Next. This is also from California Department of Public Health. It shows you just a couple of snapshots. If you see that California is issuing daily updates, see the most recent update. One question that comes up is how many cases are there? So I looked at the number of cases in California, and that was 2 days ago on the 15th. I looked today and it's gone up a little bit, but it's not astronomical. It's gone up to 574 cases that are not related to the flights of people coming from other homes. As you can see there's a word there, repatriation. That's a hard one for me to pronounce even. But the repatriation flights, that's people who were in other countries coming back in. If parents don't know what that word means, they don't understand. Okay, next slide. Obviously, you can go to Training West, the Region 9 Head Start Association. Training West is going to give you good information. You can go to the Head Start ECLKC site. The thing that I note on both of these is that both websites are going to give you recommendations and information that is based on accurate information from cdc.gov. So that's one of the things to watch for, whether it's the media or Facebook or anything else. Are they referencing cdc.gov? Next. Now here's 2 other website homepages here. If you just go to nhsa.org, you can see that their homepage is promoting the National Head Start Conference. So there's not a quick link to the coronavirus. So Ed, they may change it after this webinar. But if you go to nhsa.org/coronavirus, you immediately get information. It's very important that parents understand how to navigate the websites. Next, please. I want to spend a little more time though on social media, and particularly Facebook. That's how most people that I know get their information. And especially now that they're at home and all they have is their cell phone, they are scrolling through social media. And unfortunately, there are many people that believe if they saw it online, it must be true. Or if their neighbor said it, it must be true. The advantages of social media are immediate access to current information. It's a great way for Head Start programs to let their families know what's going on, and you can get widespread communication. The disadvantages, anyone can post anything, and unfortunately, they do. It can range from what they had for lunch to rumors about COVID-19. It's very difficult sometimes to identify the source of the information. And once something is posted, it never dies. Someone keeps sharing it. Next slide. So if you are using Facebook, there are some very good pages on Facebook. When I say it's valid and reliable, that means valid means it's accurate information. Reliable means it's always accurate information. Encourage your parents to look at some of the accurate sites on Facebook. CDC.gov. If you just go to CDC.gov, you will get their their Facebook page. You'll get the best information. You get the most recent updates. You can go state and local health departments, emergency services, state and local governments. Next, please. All right, so here is CDC's, just some recent posts from the CDC Facebook page. Immediately you have social distancing, so it's giving them information and explaining it. The symptoms were there. It tells you the coronavirus disease recommendations for people who are at high risk, tells you about not having, at that time it was gatherings of 50 or more, and now it's down to recommendation of 10 or more people. Next, please. This one is California Department of Public Health. You simply type that into your search for Facebook and you can come to their Facebook page. Again, an excellent source of information. Some of the posts there, we had the latest facts and numbers on the COVID-19. There's one on California is working to keep kids fed. So that's how parents could find out, how do I feed my children? Especially if they're not in Head Start and they're not getting your information. There's a lot of other children that need our services and need to know how to get food. Without schools being open, they may not get a meal. Then also the California Department of Public Health had a something from the governor. So when you're getting that type of information, it is accurate. Next, please. California Governor Office of Emergency Services. I went to Facebook pages for emergency services from several different states. That's an excellent source of information. I had the California governor was live, and then there's also how do you wash your hands. Next, please. Go to the city pages for wherever your program is, wherever your families are living. So I went to Sacramento, and the mayor had a live presentation, updates on what's going on with the COVID-19. I also went to the city and county of San Francisco. If you're encouraging parents to do this, be sure they understand the difference in Facebook pages. If you type in the city of, I typed in San Francisco, and there were a number of different pages I could go to. So I had to look closely to make sure it was the city and county of San Francisco government. One problem with Facebook pages is there's a difference in the page, and then there's group pages. So you could have a page that's, one I looked at was Homeland Security, and it was Homeland Security Intelligence. So with that one, it's going to give accurate information. Well, there's another one that's called Homeland Security Intelligence, and then in parentheses it said, I think Investigations Division. It wasn't their website, I mean their Facebook page. It was a group that people could join to find out things, but anybody could post any information. So I unfollowed that group because I was getting misinformation from group members. So be careful to know that you are on the actual Facebook page. Next, please. Again, the Training West, the Region 9, and one of the posts that Region 9 had was from the California Department of Education. In Kentucky, I was looking at the education and all, and there was a Facebook page for school counselors. So I looked at California to see if there was a Facebook page for school counselors. I did not find that, but I did find the California School Resource Officers Association, and immediately saw this post from Stephen Sraka, and I know him. He's a pediatrician, and excellent information. So that's another good source of information. Next, please. Definitely keep up with the Region 9 Head Start Association, because Ed and his staff are going to give you accurate information and keep you up to date on everything. Next, please. Now, anybody can post on Facebook. So think about who you know, who are the people that you know have the qualifications. This is one that I followed, Terry or Teresa Medeiros. She's a New York Times best-selling historical fiction author, and her books are wonderful. She happens to live in the same town I live in. I also know that she and her husband are registered nurses with a lot of experience. So when Terry posts something, I know it's going to be accurate. She posted an article, as she said, a long but interesting article, but that particular article showed the math of how the spread of COVID-19 could overwhelm our medical system, and that's the reason we're doing the social distancing and the closures and all the precautions now. Next, please. Another person that I followed, and I took his name off of it, posted this one with the blue picture there that says the virus remains in the throat for 4 days, and so if you gargle with vinegar and salt water, it kills the virus and you won't get the disease. To me, that's a no-brainer. If that were true, China and Italy and the United States would not be having a problem. When you see something like this, it's simple to Google the keywords to it. So I Googled gargling with vinegar and COVID-19 and found a page from the American Academy of Pediatrics in Australia that took all of those statements, even beyond what he had posted, and refuted those. So I got the information. The unfortunate part is that while this particular friend did take it off his Facebook, about 30 minutes later, I saw it on somebody else's Facebook post. And it just, that's why I said when it's posted, it never dies. Next, please. This is another very important part of following the information source on COVID-19. I had already clicked on something from a friend's Facebook page where it was a live updated map from Johns Hopkins. Well, it turned out that was a scam. I didn't get anything infected because I was on my iPad and I immediately changed some passwords. But as you can see, Kentucky Office of Homeland Security has the fake coronavirus map, has a cyber bug. It has a Trojan in it. It will infect your computer. Also, there you see that New Jersey officials were warning of fake CDC workers knocking on doors. CDC is not going to knock on your door, neither is Social Security. So watch out for scammers and computer hackers. Next, please. Some lessons that we can learn from this. There's a lot. I worked with CDC for 3 or 4 years. We had a committee looking at the possibilities of pandemic flu and early childhood centers. That was back in about 2005. At that time, we still didn't come up with any solutions. We came up with identifying a lot of problems, but it's difficult to know what to do. And we were only looking at pandemic across the United States. We weren't looking at all of these shutdowns and a worldwide pandemic. So we do take those lessons. CDC and other agencies are taking those lessons and trying to figure out what to do. But look at your own procedures. Just try to think, what do we already have in place? What are we doing well? What can we improve upon? And keep washing your hands even after this pandemic is gone. Thank you.
Thank you, Charlotte. Thank you for your advice. Let me just double check our chat and our questions before we move to closing our presentations. I do first want to acknowledge a number of you have sent in positive support for doing these presentations to our presenters. So thanks for your kindness and for the efforts that we're making here. A couple of you have asked about receiving the PowerPoint. As I shared at the top end, we'll of course be posting this shortly. So let me just share with you that next step for Region 9 Head Start, on Thursday, March 19th, is we'll have 2 webinars planned with Ms. Julie Kurtz in partnership with continued.com. So you'll definitely want to check our website, region9hsa.org, and register for those webinars if the topics are of interest to you. And then next week, the week of March 26th, we'll be hosting a couple of additional presenters. One is Mike Hall from Strong Fathers, Strong Families. He's both fun and imaginative. He'll be providing us with some ideas for activities that we can do at home in small groups and with dads and multi-generational settings and so forth. So look forward to having Mike Hall with us. We'll continue to reach out to our partners and presenters who support our conferences and other activities that we do so that we can bring those good ideas to you, packaged in a manner that's both available and relevant to the times that we're in. So with that, I'm going to thank you all for attending the webinar today and wish you the best of luck and encourage you to stay safe and, of course, keep your hands washed.